Negaya, why are we seeing this significant rise in TB deaths?
You know, Yvonne, it's interesting. The world came together back in 2018 and we made a commitment to try to end TB by 2030. We started to make some headway, and then, of course, COVID-19 kicked in 2020. And as we all know, the world stood still. We were completely focused on trying to contain COVID. And so much of the health system and doctors and nurses and frontline healthcare workers, their attention, their resourcing was diverted to contain COVID-19. And as a result, you know, so many people have been affected by TB, and for the first time in over a decade, TB rates are now rising.
Which communities are most vulnerable to the disease?
So TB is what we would call a disease of poverty. It tends to take off in communities where there's high density living, where there's things like undernutrition, low educational rates, and also stigma. Whenever there's stigma as well, that can be a real problem when it comes to the spread of TB. So we primarily see TB in what we describe as low-income countries or vulnerable communities, as we've seen in the APY lands in early March of this year.
Apart from the fact that we've been preoccupied with COVID the past few years, not paying enough attention to TB and other diseases, are there any other major factors contributing to more of these greater TB numbers in the communities that you've talked about here?
Look, I think overwhelmingly it's been a result of COVID-19, which is a real lost opportunity because both are airborne infectious diseases. And when COVID came along, we actually could have ramped up our efforts to address TB as well. So primarily it's been a result of COVID and the shifting in resources. But I think it's a historic issue. I mean, TB has been around since the beginning of time. It kills about 1.5 million people every year, including 600 children every day. And there just hasn't been enough political will and enough investment in ending TB. And as a result, it continues to devastate, as I say, mainly poor communities throughout the world.
Because you say we can end it, TB is entirely preventable and curable.
I mean, that's the great sadness, and I think the injustice as well, frankly. This is a disease that is completely preventable and treatable, and there's some new treatments coming online, which is fantastic, which are going to take treatment times down dramatically, but they're also a lot more effective. But we need to make sure that those new frontline treatments are getting out to where they're needed most. Places like PNG, which have a really high rate of TB, including drug-resistant TB. So, you know, we've got these drugs now in the US, in parts of Europe, but we need to be getting them out to communities who need them most.
How effective are TB vaccines compared to, say, COVID vaccines?
It's a really important question. That the current BCG vaccine we use for TB, we've been using for over 100 years. And of course, we developed incredibly effective vaccines for COVID in just over a year, which was unprecedented. We need to have the same sense of urgency when it comes to TB and fighting TB. We actually have about 16 TB vaccines, which are currently going through clinical trials, which is really exciting. And a couple of them are looking to be highly effective. So again, we just need to scale up our investment and make sure that those vaccines can get out to where they're needed most.
Negaya, Asia Pacific is where it's needed the most. I understand it's the home to the majority of TB cases. Why is that?
Yeah, again, it's those issues and those conditions of poverty. So whenever you've got incredibly large populations, places like India, China, Pakistan, you do tend to see TB spread, and you've got really condensed living, but also condensed workplaces. And as we've learned through COVID-19, we need space, we need good air ventilation. And often when you've got thousands of people crammed in, you know, it's where TB takes off. So even in Kiribati, in fact, you know, there are parts of Kiribati where there's really high density living, and that's where we tend to see TB outbreaks.
And what role can Australia play in ending TB in this region?
You know, Australia historically has been a really strong player actually on TB, and we've got really strong bipartisan support. We had a wonderful event at Parliament House this week, and we had the Minister for International Development speaking. We also had the Shadow Foreign Minister, Simon Birmingham, speaking, and I think there is really strong bipartisan support for ending TB, which is wonderful. But there's an excellent opportunity, I think, for us to step up our leadership. There's a UN high-level meeting on TB happening in September in New York this year. And this is really an opportunity for the world to come together and reassert our commitment to ending TB by 2030. But we've also got to back that up with adequate financing. And Australia played an incredible role 20, 30 years ago with HIV, not only did we contain the HIV epidemic in Australia, but we took that expertise throughout the world, and we're now known as a real leader on HIV. And that's the kind of leadership I think we need from the Australian government and from Australian scientists, I think, in the fight against TB.
And just finally, on World Tuberculosis Day, what should we be more aware of as individuals? How do we know if we've got the disease and can spread it to others easily, for example?
You know, TB is fairly well contained in Australia. There's only about 1,000 cases a year. They tend to be in migrant communities. First Australians, of course, are a lot more vulnerable. But I think what we need to know is this is a pandemic. It's a pandemic that, based on current trends, is killing more people every day than COVID-19. So I think that knowledge, just the knowledge, is really important. And if people are interested in learning more, there's a lot on our website, results.org.au. We're lighting up about 20 buildings red throughout the country tonight to really shine a light on the issue of TB. So raising awareness, speaking to your friends, speaking to your neighbours, all of that really helps.
Negaya Chorley, thank you so much for joining us on The World.
Thank you so much, Yvonne.